Hello friends and welcome to my channel. Today we'll be learning about the hip bone. The hip bone. The hip bone is a large irregular bone. It is made up of three parts. The ilium superiorly, the pubis antero-inferiorly and the ischium postero-inferiorly. The three parts are joined together at the acetabulum, which is a cup-like concavity. The pubis and the ischium are separated by an obturator foramen. The acetabulum articulates with the head of the femur to form the hip joint. The pubic parts of the two hip bones join anteriorly to form the pubic symphysis. The two hip bones together form the pelvic girdle. This is the pubic symphysis, and what you see here is the pelvic girdle. Now let's learn about the parts of the hip bone in detail. Firstly, the ilium. The ilium or the flank forms the upper expanded plate-like part of the hip bone. Its lower part forms the upper 2/5 of the acetabulum, as you can see right here. The ilium has the following parts: an upper end which is called the iliac crest, a lower end which is fused with the pubis and the ischium at the acetabulum, three borders: the anterior border, this is the anterior border, posterior border and the medial border, and three surfaces: the gluteal surface, the iliac surface or the iliac fossa, and the sacropelvic surface. The ilium has the following parts: an upper end which is called the iliac crest, the lower end which is fused with the pubis and the ischium at the acetabulum, here, three borders: the anterior border, posterior border and the medial border. Since this is the anatomical position of the hip bone, we consider this as the anterior, posterior and the medial border. And finally, there are three surfaces: the gluteal surface here, the iliac surface or the iliac fossa, and the sacropelvic surface. Now let's learn about the iliac crest. The iliac crest forms the upper end of the hip bone. Vertically, it is convex upwards. Anteroposteriorly, it is concave inwards in front and concave outwards behind. The anterior end of the iliac crest is called the anterior superior iliac spine. It is an important landmark that is easily felt in the living. The posterior end of the iliac crest is called the posterior superior iliac spine. The iliac crest is divided into a large ventral segment and a short dorsal segment. The ventral segment forms more than 2/3 of the iliac crest. The dorsal segment forms less than 1/3 of the iliac crest. The ventral segment has an outer lip, an inner lip and an intermediate area. The tubercle of the iliac crest is an elevation that lies 5 cm behind the anterior superior iliac spine. That is right here. The dorsal segment has a lateral and a medial slope separated by a ridge. Now let's look at the borders of the ilium. The anterior border starts from the anterior superior iliac spine and runs down to the acetabulum. The upper half of the anterior border forms a notch, while the lower half presents an elevated area called the anterior inferior iliac spine. The lower half of the anterior inferior iliac spine is large, triangular and rough. Now the posterior border extends from the posterior superior iliac spine to the upper end of the posterior border of the ischium. Now as you can see, this is the ischium, this is its posterior border and this is its upper end. So the posterior border of the ilium extends from the posterior superior iliac spine to the upper end of the posterior border of the ischium. Just below the posterior superior iliac spine lies the posterior inferior iliac spine. There is a presence of a great notch below the posterior border of the ilium called the greater sciatic notch. This is the greater sciatic notch. Now, the medial border lies on the inner surface or the pelvic surface and extends from the iliac crest above to the Ischiopubic eminence below. It separates the iliac fossa from the sacropelvic surface. This is a medial border. Let's look at the surfaces. The gluteal surface forms the outer surface of the ilium. It is convex anteriorly and concave posteriorly, just like the iliac crest. It is divided into 4 areas, 1, 2, 3 and 4 by 3 gluteal lines, the posterior, anterior and the inferior gluteal line. The posterior gluteal line is the shortest and begins 5 cm anterior to the posterior superior iliac spine, and it extends downwards to the upper part of the greater sciatic notch. This is the posterior gluteal line. The anterior gluteal line extends 4 cm behind the anterior superior iliac spine and extends downwards to the middle of the upper border of the greater sciatic notch. This is the anterior gluteal line. The inferior gluteal line, which is the most ill-defined, begins a little behind and above the anterior inferior iliac spine and runs backwards and downwards to reach the apex of the greater sciatic notch. The iliac fossa is a large concave area on the inner surface of the ilium. It is situated anterior to the medial border, and it forms the lateral wall of the false pelvis. The sacropelvic surface is an irregular surface on the inner side of the ilium. It is located behind the medial border. It has 3 parts: the iliac tuberosity, the auricular surface and the pelvic surface. The iliac tuberosity is a large roughened area situated below the dorsal segment of the iliac crest. This is the iliac tuberosity. The auricular surface is large but pitted. It articulates with the sacrum to form the sacroiliac joint. The pelvic surface is smooth and lies antero-inferiorly to the auricular surface. Now let's learn about the attachments on the ilium. Before I start with that, please note that the red color symbolizes the origin of muscles, the blue color represents the insertion of muscles, and the green color represents the attachments of ligaments. The anterior superior iliac spine gives attachment to the lateral end of the inguinal ligament. It also gives origin to the sartorius muscle that you can see right here, marked in red. This is the anterior view of the right lower limb. This is the inguinal ligament, and the anterior superior iliac spine gives attachment to the lateral end of the inguinal ligament. Now this muscle you see here is the sartorius. The anterior superior iliac spine also gives origin to the sartorius muscle. The outer lip of the iliac crest provides attachment to the fascia lata along its entire extent, origin to the tensor fascia lata in front of the tubercle, that is right here, insertion to the external oblique muscle in the anterior 2/3 that you can see here, origin to the latissimus dorsi just behind the high point of the crest. This one is the latissimus dorsi, and the attachment to the iliotibial tract at the tubercle of the iliac crest, that is right here. An easy way to remember the attachments on the outer lip of the iliac crest is the use of the mnemonic FELTI. F stands for attachment of fascia lata, E stands for the insertion of the external oblique, L stands for origin of latissimus dorsi, T for the origin of tensor fascia lata, and I for the attachment of the iliotibial tract. This is the lateral view of the human body. The muscle you see here is the external oblique of the abdomen. This muscle is the latissimus dorsi. This is the lateral view of the right lower limb. This is the iliotibial tract, and this is the tensor fascia lata. The intermediate area of the iliac crest gives origin to the internal oblique muscle along its anterior 2/3. The inner lip of the iliac crest provides origin to the transversus abdominis muscle in its anterior 2/3, attachment to the fascia transversalis or the fascia iliaca along its anterior 2/3, origin to the quadratus lumborum along its posterior 1/3, and the attachment of the thoracolumbar fascia around the attachment of the quadratus lumborum. This is the quadratus lumborum muscle. This is the thoracolumbar fascia. Now let us look at the attachments on the dorsal segment of the iliac crest. The lateral slope gives origin to the gluteus maximus muscle, as you can see right here. The medial slope gives origin to the erector spinae muscle. The interosseous and dorsal sacroiliac ligaments are attached to the medial margin deep to the attachment of the erector spinae muscle. That is this and this. This one is the interosseous sacroiliac ligament and this is the dorsal sacroiliac ligament. This is the posterior view of the right lower limb. The muscle you see here is the gluteus maximus muscle. Moving on to the anterior inferior iliac spine, the upper half of the spine gives origin to the straight head of the rectus femoris muscle. The lower half of this spine gives attachment to the iliofemoral ligament. This is the anterior view of the right lower limb. The muscle you see here is the rectus femoris muscle. This is the iliofemoral ligament. Now looking at the posterior border of the ilium, few fibers of the piriformis muscle originate from the upper border of the greater sciatic notch, that is right here. This is the lateral deep view of the right lower limb. The muscle you see here is the piriformis. Now moving on to the attachments on the gluteal surface of the ilium, the area behind the posterior gluteal line gives origin to the gluteus maximus muscle, as you can see here. This is the posterior gluteal line and this is the gluteus maximus muscle. The area between the posterior gluteal line and the anterior gluteal line gives origin to the gluteus medius muscle, this one. The area between the anterior gluteal line and the inferior gluteal line gives origin to the gluteus minimus muscle, this one. The area below the inferior gluteal line gives origin to the reflected head of the rectus femoris muscle, this one right here. This is the posterior deep view of the right lower limb. The muscle you see here is the gluteus maximus. This is the gluteus medius and this is the gluteus minimus. This is the right hip joint. The muscle you see here is the reflected head of the rectus femoris muscle. The iliac fossa gives origin to the iliacus muscle in its upper 2/3. This is the iliacus muscle. The iliac tuberosity gives attachment to the interosseous sacroiliac ligament in its greater part, the dorsal sacroiliac ligament posteriorly, and the iliolumbar ligament superiorly. This is the iliolumbar ligament. The convex margin of the auricular surface gives attachment to the ventral sacroiliac ligament. Now let us look at the attachments on the pelvic surface. This is the preauricular sulcus. It is larger in females as compared to males. It gives attachments to the lower fibers of the ventral sacroiliac ligament. Lateral to the preauricular sulcus, there is origin of few fibers of the piriformis muscle, as I had mentioned earlier. The rest of the pelvic surface gives origin to the upper half of the obturator internus muscle. Now let's learn about the next part of the hip bone, that is the pubis. The pubis forms the antero-inferior part of the hip bone. It also forms the anterior 1/5 of the acetabulum. It has three parts: a body anteriorly, a superior ramus, and an inferior ramus. Now let's learn about the body of the pubis. The superior border is called the crest of the pubis. At its lateral end, there is a tubercle called the pubic tubercle, which is not distinctly visible in this specimen of the bone. The body of the pubis has three surfaces: the pelvic surface or the posterior surface, the medial surface or the symphysial surface, the anterior surface or the femoral surface. The posterior or the pelvic surface is directed backwards and upwards. It forms the anterior wall of the true pelvis, and it is also related to the urinary bladder. The medial or the symphysial surface articulates with the opposite pubis to form the pubic symphysis. The anterior or the femoral surface is rough superomedially and smooth elsewhere. Now let's learn about the superior ramus. The superior ramus extends from the body of the pubis to the acetabulum, above the obturator foramen. This is the superior ramus. It has three borders and three surfaces: the anterior border, the superior border, and the inferior border. And three surfaces: the pectineal surface, the pelvic surface, and the obturator surface. The superior border is called the pectineal line or the pecten pubis. It extends from just behind the pubic tubercle to the posterior part of the iliopubic eminence, that is right here, from here to here. The anterior border is called the obturator crest. It extends from the pubic tubercle to the acetabular notch. This is the anterior border. The inferior border is sharp and forms the upper margin of the obturator foramen. The pectineal surface is a triangular area between the anterior border and the superior border. It extends from the pubic tubercle to the iliopubic eminence. The pelvic surface lies between the superior border and the inferior border. It is smooth and continuous with the pelvic surface of the body of the pubis. The obturator surface lies between the anterior and the inferior borders. It presents the obturator foramen. Now let's look at the inferior ramus. It extends from the body of the pubis to the ramus of the ischium, medial to the obturator foramen. It unites with the ramus of the ischium to form the conjoint Ischiopubic rami. Now let's learn about the attachments on the pubis. The pubic tubercle gives attachment to the medial end of the inguinal ligament and the ascending loops of the cremaster muscle. The tubercle is crossed by the spermatic cord in males. This is the inguinal ligament and this is its medial end. Now an easy way to remember the attachments on the pubic tubercle is by the use of the mnemonic ICE. I stands for the inguinal ligament and the green color represents its attachment, while CE stands for cremaster muscle and red color represents its origin. The medial part of the pubic crest is crossed by the medial head of the rectus abdominis, while the lateral part of the pubic crest gives origin to the lateral head of the rectus abdominis and the pyramidalis muscle. The muscle you see here is the rectus abdominis. Now an easy way to remember this is by the use of the mnemonic RAP. R stands for rectus abdominis, both the medial and the lateral head, which have origins, and P stands for pyramidalis, which also has an origin on the pubic crest. Now let's learn about the attachments on the anterior surface of the body of the pubis. It gives attachment to the anterior pubic ligament medially. It gives origin to the adductor longus that you see here in the angle formed between the pubic crest and the pubic symphysis. It gives origin to the gracilis near the margin of the pubic symphysis and onto the inferior ramus. Lateral to the gracilis is the origin of the adductor brevis that you see here. And then there is the origin of the obturator externus along the margin of the obturator foramen. This muscle you see here is the adductor longus. This muscle is the adductor brevis. This is the gracilis muscle. This is the obturator externus muscle. Now an easy way to remember the attachments on the anterior surface of the body of the pubis is by using the mnemonic GOA with 3 A's. G for gracilis, O for the origin of obturator externus, A for the origin of adductor longus, A for the origin of adductor brevis, and A for the attachment of the anterior pubic ligament. The posterior surface of the body of the pubis gives origin to the levator ani in its middle part, origin to the obturator internus laterally, and attachment to the puboprostatic or pubovesical ligament medial to the origin of the levator ani. This is the levator ani muscle. An easy way to remember the attachments on the posterior surface of the body of the pubis is by the use of the mnemonic Paul without an L. P stands for the attachment of the puboprostatic or pubovesical ligament, O stands for the origin of obturator internus, and L stands for the origin of the levator ani muscle. The pectineal line gives attachment to the conjoint tendon at its medial end, the lacunar ligament in front of the conjoint tendon, that's right here. It gives attachment to the pectineal ligament of Cooper, just lateral to the attachment of the conjoint tendon along the entire length of the pectineal line. It gives origin to the pectineus muscle, which arises from the entire length of the line. And finally, it gives insertion to the psoas minor when it is present. An easy way to remember the attachments on the pectineal line is the use of the mnemonic CLAP with 3 P's. C stands for the attachment of the conjoint tendon, LA stands for the attachment of the lacunar ligament, P stands for the origin of pectineus, T stands for the attachment of the pectineal ligament of Cooper, and P stands for the insertion of the psoas minor muscle. The pectineal surface gives origin to the pectineus muscle. The pelvic surface is crossed by the round ligament of uterus in females and by the ductus deferens in males. Now let's learn about the last part of the hip bone, that is the ischium. The ischium forms the postero-inferior part of the hip bone and the adjoining 2/5 of the acetabulum. It forms the posterior boundary of the obturator foramen, right here. It has a body and a ramus. The body of the ischium is a thick and massive mass of bone that lies beneath and behind the acetabulum. It has 2 ends, the upper and the lower end. 3 borders, the anterior border, the posterior border, and the lateral border. And 3 surfaces, the femoral surface, the pelvic surface, and the dorsal surface. The upper end of the ischium forms the postero-inferior 2/5 of the acetabulum. The ilium, the ischium, and the pubis fuse together at the acetabulum. The lower end of the ischium forms the ischial tuberosity. It gives off the conjoint Ischiopubic rami that makes an acute angle with the body. The anterior border of the ischium forms the posterior margin of the obturator foramen. The posterior border of the ischium is continuous with the posterior border of the ilium. Here we can see the greater sciatic notch. and at the end of the greater sciatic notch is the ischial spine. Below the ischial spine, we can see a lesser sciatic notch. This entire part forms the posterior border of the ischium. The lateral border forms the lateral margin of the ischial tuberosity except at its upper end where it is rounded. The femoral surface of the ischium lies between the anterior border and the lateral border. The dorsal surface of the ischium is continuous with the gluteal surface of the ilium. The ischial tuberosity is divided into an upper area and a lower area by a transverse ridge. The upper area is further subdivided by an oblique ridge into a supralateral area and an infromedial area. The lower part is divided into an inner area and an outer area by a longitudinal ridge. The pelvic surface of the ischium lies between the anterior border and the posterior border. It forms the lateral wall of the true pelvis. Now let's learn about the conjoint ischiopubic rami. The inferior ramus of the pubis joins with the rami of the ischium medial to the obturator foramen to form the conjoint ischiopubic rami. It has an upper border and a lower border and two surfaces, the outer surface and the inner surface. The upper border forms the part of the margin of the obturator foramen. The lower border forms a part of the pubic arch. The inner surface is smooth and convex and is divided into upper, middle and lower parts by two ridges. The outer surface is rough for the attachment of the muscles. Now let's learn about the attachments on the ischium. The ischial spine provides attachment to the sacrospinous ligament along its margin. It gives origin to the levator ani muscle on its pelvic surface. The lesser sciatic notch is occupied by the tendon of the obturator internus. There is a bursa deep to the tendon. It is lined by hyaline cartilage. The upper and lower margins of the notch give origin to the superior and inferior gemelli respectively. The femoral surface of the ischium provides origin to the obturator externus along the margin of the obturator foramen. It also gives origin to the quadratus femoris along the lateral border of the upper part of the ischial tuberosity. That is right here. Now let's learn about the attachments on the ischial tuberosity. The supralateral area gives origin to the semimembranosus muscle. The infromedial area gives origin to the semitendinosus and the long head of the biceps femoris. The outer lower area gives origin to the adductor magnus muscle. The inner lower area is covered by fibrofatty tissue and a bursa that supports the body weight in the sitting position. The sharp medial margin of the ischial tuberosity gives attachment to the sacrotuberous ligament. The lateral border of the ischial tuberosity gives attachment to the ischiofemoral ligament just below the acetabulum. This is the posterior view of the right lower limb. The muscle you see here is the semimembranosus muscle. This is the semitendinosus muscle. This is the biceps femoris. And this is the adductor magnus. The greater part of the pelvic surface of the ischium provides origin to the obturator internus muscle. Now let's learn about the attachments on the conjoint ischiopubic rami. The upper border provides attachment to the obturator membrane. The lower border provides attachment to the fascia lata and to the membranous layer of the superficial fascia or collis fascia of the perineum. This is the fascia lata. The muscles taking origin from the outer surface of the conjoint ischiopubic rami include the obturator externus muscle along the margin of the obturator foramen, the adductor brevis muscle that takes origin chiefly from the pubic ramus, the gracilis muscle that originates from the pubic ramus, and the adductor magnus muscle that chiefly originates from the ischial ramus. The attachments on the inner surface of the conjoint ischiopubic rami are the origin of the obturator internus on the upper area, the origin of the deep transverse perineum in the middle area, and the origin of the superficial transverse perineum and the ischio-cavernous muscle in the lower area. I hope you found this video helpful. To get updates on my latest videos, click on the subscribe icon. To get notifications, tap the bell icon. Thank you for watching.